Hello and welcome to Healthy Living. I'm your host Melissa Hodgson, and we're talking today about St. Tammany Cancer Center, a campus of Ochsner Medical Center. We'll talk with Jack Cashew, the administrator of the Cancer Center, Dr. Elizabeth LePere about Integrative Oncology, and then we'll talk with Ashley Uze, registered dietitian at the Cancer Center, about the importance of nutrition and diet when fighting cancer. So Jack, welcome to Healthy Living. We're glad you're here.
Thank you for having me.
So I guess first off, as administrator of the Cancer Center, connect the dots for us, future and past. The new St. Tammany Cancer Center is a campus of Ochsner Medical Center, and it's the continuation of decades of partnering in cancer for St. Tammany Health System. Tell us a little bit about how we got where we are.
Sure, of course. St. Tammany's been recognized by the Commission on Cancer since the 90s as a site. So we've been accredited for a long time, so a long legacy in oncology. And this is really a connection, to be honest, not just between our cancer program at the hospital, but it connects obviously some of the outpatient services that we've provided, in different locations throughout the years with our Ochsner partnership to provide the continuum of care. A lot of folks believe that only oncology care happens maybe in a cancer center or a cancer building. But really, a lot of the care happens at the hospital with the diagnosis and the treatment pieces. And with our Ochsner partnership, we're able to offer a lot of things like integrative oncology, which we'll talk about in a little bit, and really access to some of the tertiary, even quaternary care that they provide at the main campus. So really a nice connection between the legacy of being a hospital who does a lot of diagnosis and treatment with a tertiary quaternary partner.
Fantastic. So really you're talking about a complete cancer program, and this new facility, the Cancer Center, is a bit of the heart of it, but it's not the whole story.
No, that's correct. That's correct. Just, obviously a lot of the physicians are in the building that do a lot of the diagnosing and treatment and the survivorship pieces, but so much work is done outside of that building in other venues. So yes, it covers the continuum of care, which is important when you're going, for the care of these patients, because it's very, it's complex and there's a lot of different entities that need to be involved. So it's good to have, obviously, all the entities kind of working together in one medical record and one program.
Right, so all of the entities working together, that brings to mind in that new center, yes, it's a beautiful new 75,000 square foot building and everybody's excited about how gorgeous it is and just what a zen feeling it is to be in there with the art and the light, the natural windows letting light in. But when it comes right down to it, it's also important that we have all modalities in the same place.
Yes, we do. We do. And we have consolidated most of the modalities there. Obviously, we do advanced imaging, we have radiation, infusion, of course, and the clinic piece, but we also have some of the services that aren't directly related to medical care, which is, in our lanyap services where we're doing the integrative oncology piece. Acupuncture is part of that focus. Our dietitians obviously doing a lot of the work there too. So yes, we do have a lot of the medical services there, but I think in this project, in this building, we've really provided some of the social components that go into caring for these patients, which is new for us.
Beautiful. And so you have that social aspect and the integrative aspect. You have chemotherapy.
Yes, ma'am.
You have advanced imaging and radiation, oncology. Surgical oncology wouldn't occur inside that building, but it is a part of our cancer program, and it is an exceptional area for St. Tammany Health System. Can you talk a little bit about our cancer surgery?
Yes, actually, that's one of the parts that we're really most excited about, because I think everybody traditionally talks about the medical oncologist and the radiation oncologist. But really, an effort also to be in that building is to provide multidisciplinary clinics with some of our surgeons in our community and some of the surgeons from the Ochsner main campus to provide a more streamlined clinic approach. So, for example, you don't have to see that linear experience where you see a doctor in one building and then maybe multiple days or many days later see a physician in another building. We're hoping that in the near future we'll be able to see for each site, maybe see 1 or 2, 3 doctors at the same time. Maybe not simultaneously, but within the same visit, and they've conferred over the patient care, and they're really making recommendations for treatment options and outcomes, and having a conversation with the family potentially, who can hear from multiple physicians at one time. So the surgical oncologists are very important to our program, and in that building, the goal is to provide multidisciplinary clinics where they could see patients potentially with the medical oncologist, the radiation oncologist, or maybe even some of the medical specialists that we have in our community who are going to rotate through that building also. So very important to the program.
Fantastic. So for example, a local Covington urologist or gastroenterologist could be part of a multidisciplinary approach. a breast surgeon such as Dr. Angela Bonagera, who is a part of St. Tammany Health System, could be right there with those other modalities in the center in that multidisciplinary approach.
Yes, yes, that's actually the goal. I think breast is a good example. They may want to have a clinic where when they're sharing patients with the medical and radiation oncologist, one morning where all three disciplines see the patient at the same time, and then obviously move forward. It actually helps a lot with the patient anxiety too, because you're not, once again, you're getting kind of the full picture, and you're not trying to connect the dots on your own, which we hear a lot from our patients of how frustrating, quite honestly, can be sometimes to try to piece information together from multiple physicians, multiple locations. So yes, that would be a great example. Breast, lungs, another one. We like to, GI is another area. Maybe the gastroenterologist seeing the patients with the GI surgeons. Maybe just a two-person type multidisciplinary clinic visit. Yeah, but that is the goal, and I think that'll be something that patients will really benefit from.
Fantastic. And so that new space takes into consideration that you have people who work there all the time and people who may be coming there on a rotating basis or on a specific patient visit basis.
Yes, yes. Yeah, that's the plan, is, because obviously all the disciplines don't have to be there every day, so we are working on a rotating basis, but it's got to be frequent enough so that patients don't have to wait, because access is important. Obviously, especially when you have a diagnosis, you want to make sure you address it quickly. So, not that it's going to be every day, but each discipline should be seen once a week at least, so that if you have a new diagnosis within that time, they're able to get in quickly and really get a game plan that hopefully will help them feel better about moving forward.
And that speed to care, I think, is one of the things that was crucial to the decision to move the center, right? St. Tammany Cancer Center actually has been growing and outgrowing its space for some time. Was it in 2016 or 17 that it was first reconfigured?
That's correct.
And then expanded the next year. And then once it ran out of room, you began to look at how to continue to serve more Northshore patients locally and not have them travel far for fast care. And that's ultimately what resulted in the building?
Yeah, and yes, we quickly became more of a community cancer center and really become a regional cancer center. And a lot of that is a testament to the sophistication of our medical staff. We have a lot of physicians who do things that maybe in previous years they would have gone to other locations to get the diagnostics or even the treatment options. So that, along with just wanting to provide more support services, which we ran out of room, around the patient care piece, not just the medical pieces, really caused us to take a look at this and say, how can we provide more services to the patients, and how we get more physicians involved in the program who are seeing these patients maybe in different locations, and to my earlier point, causing that frustration with that fragmented care. So we really wanted to streamline the experience.
So a much more patient-centric experience. Patients can expect most of what they need to be in one location.
Yes.
And on a routine basis, if they need labs or things like that, those are going to be available to them at that visit.
Absolutely.
And they'll have the multidisciplinary opportunity that you talked about, where maybe medical oncology, radiation oncology, surgery, or specialties like urology, gastro, et cetera, may be collaborating together on their case at that location. So that's pretty exciting. And then from the standpoint of that decision to move and running out of space, I have a mental picture of, the old cancer center. As we grew and became capable of caring for more people, we kept reconfiguring and finding a way to serve more patients in that same square footage. But now, in this 75,000 square feet of open air space, we've been able to create these pods where a patient and their caregiver can spend that infusion time or what have you, able to see out.
Yes. I mean, that's exactly. I mean, one of the things, obviously, is patients come with caregivers, and one of the things that we want to do is create a better caregiver experience also, not just from the patient's perspective. So in our former, unfortunately, obviously, volumes have grown, incidence rates are up, but on the flip side, I know survivorship and outcomes are improving all the time. So we have more survivors than ever, so that's really a great situation to be in. So yes, when we constructed the building, you mentioned the lab, and lab's on the first floor. We made it convenient because the patient can run in and run out. They don't have to go through the whole maze of a hospital piece, so that's part of what we thought about. In the infusion suite, we added spaces. We have an outdoor balcony because patients sometimes are there for a long time, and they could, maybe just want some fresh air. So we really thought of how to do the pods where a caregiver could be involved, and we also thought about how we can provide some amenities. Soon here in the next 6 to 8 weeks, we'll also provide a coffee shop and things that, some of the things that you don't think about when you're there in a building for a long time to help make just the day go by a little bit faster.
Beautiful. Well, Jack, thank you so much for coming to tell us about St. Tammany Cancer Center and the campus of Ochsner Medical Center. We're excited to have it up and running at I-12 and Highway 21 in Ochsner Boulevard.
Thank you for having me.
All right. You're watching Healthy Living. I'm your host, Melissa Hodgson with St. Tammany Health System. We'll be back next with Dr. Elizabeth LePere to talk about integrative oncology.
Here on the Northshore, along these halls, there are many minds at work. At St. Tammany Health System, many innovations happening now, and even more on the horizon. Many reasons we're number one.
Welcome back to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about St. Tammany Cancer Center, a campus of Ochsner Medical Center. We spoke first with Jack Cashew, administrator of the new center, and we'll speak next with Dr. Elizabeth LePere, medical director of Integrative Oncology and Survivorship. Welcome to the show. Thank you so much for being here.
Thank you for having me.
So I guess I want to start with, you're the collaborating and lead physician for St. Tammany Cancer Integrative Oncology. So let's start with what integrative oncology means.
Sure. Because it does mean a lot of things to different people. But integrative oncology is a patient-centered approach that's evidence-informed and really incorporates lifestyle modifications such as nutrition and exercise, mind-body techniques, and other modalities such as acupuncture, yoga, along with conventional cancer care.
Okay, so recognizing that chemotherapy, immunotherapy, radiation oncology, surgery, all of those traditional modalities are important to eradicating the cancer. Integrative oncology is taking all of that a step further and saying, what about this whole person and their life?
Correct.
Okay, so talk about, you said mind-body connection. Tell me what that is about.
So, patients go through so much during their cancer treatment and have a lot of negative side effects while they're going through their cancer treatment, and they're left with long-standing negative side effects. And that can be insomnia, anxiety, chronic pain, sexual dysfunction, a lot of different side effects. And so, mind-body kind of helps bring those stressors down and helps you kind of get through that cancer treatment, decreasing anxiety, recognizing that meditation, for some people prayer, different things that really help you decrease stress and get through those tough times.
So mind, body, spirit.
Correct. Mind, body, spirit.
Absolutely.
Yeah.
Okay, well that is beautiful. So as we're looking at integrative oncology and that mind-body connection and how that relates, your discipline of medicine is actually taking that into the care setting. So talk at the Cancer Center what patients and their families can expect out of the Lanyap services, the integrative oncology piece at the center.
Well, we always focus on patient safety and evidence-informed care. And so there's a lot of information out there, on the internet and Google and blogs. And some of it's good information, but we try to take that when the patient and the families come in, and the families often come in with a lot of questions too, and look at, okay, this supplement might be okay for your sister, but it's not necessarily okay for you because you're undergoing chemo or radiation, or you also are taking a high blood pressure medication or medication for your diabetes. And we don't want to do anything that prevents the overall care for the patient.
Okay. So keeping an eye on each of those traditional routes that we may be following to take care of the cancer, you're taking a bigger look and saying, okay, well, you heard about this supplement or you've heard that you should eat that food. Let's understand what that does to your specific case.
Correct.
And I think that idea of your specific case is one of the beautiful things about this whole concept of St. Tammany Cancer Center, a campus of Ochsner Medical Center, that there's a multidisciplinary approach, and integrative oncology is a part of that.
Right. I mean, I kind of see myself as the quarterback for sending patients to the nutritionist, who you're going to talk to later, sending to the acupuncturist, telling patients about Tai Chi or yoga. I mean, I don't do all those therapies, but we work them in and weave them into their conventional cancer care so that they really can get through their treatment and also have quality of life.
Sure. And, you're talking about how the mind-body experience for someone who is faced with the challenge of cancer as being different from, your run-of-the-mill working person who's, going about their life, maybe no other issues. All of a sudden, aside from this cancer diagnosis, which is scary enough, there are things happening to their body. And some of those things are a function of the cancer. Some of them are a function of these traditional modalities we need to follow to get rid of that cancer.
Right.
I can think of one, a lot of folks don't realize there is sometimes some tattooing of the skin that's necessary in radiation therapy. And people don't go into this thinking they're going to come away with a tattoo.
Right.
And there's a mental component to that. So from an integrative oncology standpoint, is that someone that you would be working with to help them maybe with some social work, therapy, maybe psychology, to help them understand what's needed to succeed?
Absolutely. I mean, our psychologists and social workers and psychiatrists sometimes are so important in that and patients, sometimes come in with depression or anxiety, and you compound that with a cancer diagnosis. And you mentioned tattooing. Body image becomes a huge thing for patients. They're doing things to fight cancer, but they're left with, some people don't feel good about their bodies anymore, and so they kind of have to accept their new normal and learn to love themselves and what they are now. And that's where those other specialists really help the patients get through that.
Beautiful. So from that mind-body standpoint, kind of understanding and accepting their new normal and processing what that means in their family as well as for themselves.
Right.
And I think the family is an important part of what the St. Tammany Cancer Center there in the new building is able to bring, because family members can be with the patient. There are some things baked right into the construction of that building that really make it a warm and welcome place for families and patients.
Because cancer affects the patient, but it also affects the family. You're right. And so we want to be supportive of everyone, and because those people also help support the patient. And those patients, the families come in with a lot of questions. And when you get a cancer diagnosis, all of a sudden, there are a lot of people that pull away from you, and there are other people that want to tell you, you need to eat this, you need to take this supplement, you need to do that. And so we really need to help support patients and families in the barrage of all the information they're getting to.
Wonderful. So a patient and their caregiver, their family support member can come to those appointments and have the integrative oncology experience together, kind of understanding the mind-body experience, the support that lends to all of the work that's going on to eradicate that tumor or post-surgery or radiation, et cetera.
Absolutely. And especially even during COVID, we were doing virtual visits where you would have several people on the screen listening in. So we tried to never stop that collaborative feel, not just from our team but also from the family.
Outstanding. So I think really integrative oncology brings a holistic whole body aspect to what has traditionally been a focus in cancer care on eradicating the disease. This really opens up and says, let's bring this person into next stage of life and recognize that their whole life is affected by cancer.
That's right. And we have more and more survivors. So we also have to look at their other medical issues. So, you can have a cancer patient that, for all essential purposes, is cured of their cancer, so to speak. They never feel that way. I know, and I know the fear is always there, so I don't want to, belittle that. But then they have uncontrolled diabetes. So, we really, or heart disease, or, high cholesterol. So we really need to look at the whole patient and help them, with their overall health, not just the cancer piece. So I really try to look holistically and say, let's look at this to kind of help you, prolong life.
Outstanding. Well, Dr. LePere, thank you so much for coming in and teaching us about integrative oncology.
Thank you for having me.
You're watching Healthy Living, brought to you by St. Tammany Health System. We're talking today about St. Tammany Cancer Center, a campus of Ochsner Medical Center.
We're not doing a lot of traveling these days, but when you think about it, everything we really need is right here close to home. Like world-class ortho care at St. Tammany Health System. Many firsts, many smiles, many reasons we're number one.
Welcome back to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about St. Tammany Cancer Center, a campus of Ochsner Medical Center. We spoke first with Jack Cashew, administrator of the center, and then with Dr. Elizabeth LePere about integrative oncology. We'll speak last with registered dietitian Ashley Uze. Welcome, Ashley. We're glad you're here.
Hi, thanks for having me.
So, as a registered dietitian, you are part of that holistic approach we were talking about with Dr. LePere in integrative oncology, a recognition that we can treat the cancer, but we have to also help the person with their daily life. We as humans always have to eat, but with cancer, eating becomes much more complicated.
Absolutely.
So talk a little bit about nutrition and cancer.
Sure. So, as you mentioned, nutrition is very important to begin with. However, when it comes to cancer and a cancer diagnosis, it's very difficult because you have to change a patient's mindset and the fact that you're not necessarily going to be eating for pleasure per se, but you have to combat your diagnosis and you have to maintain a healthy nutritional status in order for you to feel the best that you can through your treatment, along with allowing your physicians to continue your treatment. A lot of times patients lose a lot of weight, they become malnourished, they start to lose their muscle mass, and with all of that going into a cancer diagnosis, sometimes the chemotherapy is just harsh on them and they don't tolerate it as well. Along with different side effects, like Dr. LePere was talking about, a whole bunch of the side effects do relate to nutrition, such as nausea, vomiting, abnormal bowel movements. Those are just the common things that people think about. There's a whole list of complications that could occur, one being cold sensitivity with certain medications. So now as a dietitian, I have to explain to people that you can't eat or drink cold things, which although it might sound easy, it's really not. And then altered taste changes is very common, and it's never the same with each patient. Every patient is different. Some patients taste metal, some patients taste nothing. And it could be something as simple as saying, hey, maybe you should use plastic utensils instead of metal utensils so that that taste would kind of diminish to allow their nutritional intake to become better.
Wow. So, from the standpoint of the food itself and the job it's doing in the cancer patient's body, there's that. But then beyond those physiological changes, taste, smell, et cetera, there are some lifestyle impacts that people don't always think about when it comes to cancer nutrition. Some of those challenges like social and emotional things, maybe financial challenges. And that's where you and some of your fellows in the Cancer Center, financial counselors, social workers, you all work as a team.
Absolutely.
And so when you're meeting with someone and they're talking about taste, you also are looking for some cues about what their food situation may be.
Absolutely.
Can you talk a little bit about how you all work as a team?
Of course. I could not do this by myself. Our social workers and myself have been working very closely together to help the patient as a whole. It's not just the patient. Cancer is a family diagnosis. There are situations that some people don't like to talk about. A lot of times their nutritional status could be directly correlated to their anxiety or their depression, which is out of my scope, which will then allow me to bring in the social worker or bring in our clinical psychologist to assist with the mental aspects, because I can't get their nutrition status up to par if they have underlying challenges such as a cancer diagnosis, and the anxiety that comes with it. We do have a lot of resources that we do assist patients with, and you know, I tell patients to eat healthy, eat a high-calorie diet, high protein, but I never thought until I started working here, well, what if they can't afford that? We have patients who can't afford getting to treatment, so how are they going to afford to get to the grocery store? And those things seem so big to the patients, and which they are, but a lot of these things can be assisted by us, our social services that we provide at the Cancer Center between myself and the social workers. We assist with transportation. We have a therapeutic food pantry to assist with food insecurity. And we even have grants and different programs that we work through that I can get patients meals, hot meals delivered to them, because not all the time would they want to even go home and stand over the stove to cook.
Sure, and maybe not want to or can't.
Absolutely.
That's fantastic. So through St. Tammany Hospital Foundation and other philanthropic support, you are able to get patients whatever they need through St. Tammany Cancer Center.
Absolutely. And so in the therapeutic food pantry alone, we have shelf-stable food that we get from the Northshore Food Bank. We also get dairy and produce from other vendors that I could provide to patients who report that they have food insecurity. And one thing that I have learned as a dietitian going through learning with my patients is that they might not have the food insecurity from the very beginning. They might have a stable job, great insurance, and then in the middle of their treatment, they might lose their insurance, or they might not be able to work and they don't have a spouse to assist. So that's where the social workers come in, and they constantly look at the patient's financials and mental state, because that changes constantly throughout treatment. And I don't always set up patients with any of these resources from just the very beginning. It could be at treatment 2, or it could be close to the end of their treatment.
So throughout that cancer journey, everyone in St. Tammany Cancer Center is focused on that whole person. It's not just about chemo or radiation or surgery and then follow-up. It's everything that that patient and their family member needs, from nutrition to social work and support to exercise, mental health support, financial support. And it sounds like there are a lot of aspects that you have to, as a dietitian, kind of think through in that integrative model. And I think you told me about something that I wanted us to look at together, and that is this chart that helps you think about oncology nutrition from an integrative standpoint. Can you walk us through it?
Absolutely. This is an excellent graphic that allows me to explain how it is an entire, not only patient approach, it's an entire family approach. And that it's multiple entities that are needed to allow for the best patient care for those patients. So to walk through a specific example, you can see that there are measurable aspects, immeasurable aspects. There's individuals such as the patient alone, and then there's the patient's family. So it might all start with patients have predeceived decisions before they come into my office. They know what they like, they don't like. They have cultural beliefs in regards to certain foods. And then on top of it, they could have an ill relationship with food. And on top of that, they got a cancer diagnosis. So that's where the mental state comes in, the stress challenges come in. And then you go over, so all of these aspects, food preferences, stress, and mental state, alter their dietary intake. So as a dietitian, I'm trying to decipher what is their dietary intake, what side effects are they having before treatment, what side effects are they having during treatment, how is their dietary intake altered because of that, and how can I assist them? Because the whole mind-body approach, again, is in relation to food, activity level, and sleep quality.
Food, activity level, and sleep quality.
Sure.
Fantastic. Ashley, this is amazing, and I appreciate you showing this to me, as well as covering everything about nutrition in the Cancer Center. Thank you for coming in.
Thank you.
You've been watching Healthy Living, brought to you by St. Tammany Health System. We've been talking today about St. Tammany Cancer Center, a campus of Ochsner Medical Center, located just off I-12 at Highway 21 and Ochsner Boulevard. Thanks for joining us.